In 2 years of COVID, and while the Alabama Medical Association reports dropping COVID-19 numbers, the state is still listed as a medium risk for spread of the virus as gatherings increase in big numbers this spring. News 19's Samson Tamajani spoke with a local health official and joins us now. So Samson, how cautious should we be while making plans this spring?
Well, Madison, as we've learned, that's not exactly an easy answer, and officials with the Alabama Department of Public Health are still identifying the next threats, but also remain optimistic. Through March 2022, the Tennessee Valley has seen a resurgence in many gatherings that were lost in March 2020. By now, most events have laxed pandemic measures in place. Meanwhile,
a variant that's been around for a while is sort of making its way through some countries in Europe and in China, and it's starting to be more dominant in the U.S.
Alabama Department of Public Health's Dr. Wes Stubblefield speaks of BA2, which is related to the Omicron variant that hit early this year. But current data shows an upside.
What we've seen is that the disease is potentially no more serious or severe. It may be slightly more transmissible or more easy to catch. And it may be that if you had Omicron, you may be protected. But it still remains to be seen whether or not the vaccine or a more distant infection will still be good against the BA2.
At the same time, health officials are keeping tabs on a potential additional booster dose of the COVID-19 vaccine in the coming weeks.
We don't know what will happen if they do recommend another booster because of what some changes that may happen in the legislature. We'd like people to know that there is a process, and they'll have to go through the FDA and then onto the CDC for its evaluation as well.
Even if another booster is necessary, North Alabama's senior public health official says the outlook of enjoying a more normal 2022 is good for now.
And that's why at the ADPH, that's why we're following those data very closely to make sure that we know when things are coming so we can prepare ourselves for a potential spike in terms of testing, treatments, hospital surge capacity, things like that.
In new guidance this weekend, the CDC still suggests masking up around severely immunocompromised people if you are in a medium threat area or higher. You can find more info in this story on our website at WHNT.com.